today I'm going to give you 11 lifestyle changes to reduce your risk factors for heart disease. Now, heart disease is the #1 killer in the United States. Each year, over 800,000 people have heart attacks, and one person dies from heart disease every 34 seconds. Heart disease is the #1 killer among women. In fact, it kills more women than all forms of cancer combined. It is a big, bad deal. So what can you do about it? What can you do about heart disease? Well, one thing you can do is you can change some of your habits. Yes, something as simple as changing some of your daily routines can reduce your risk factors for heart disease. Sound too good to be true? It's not, and we're going to talk about it because I'm going to give you 11 lifestyle changes to reduce your risk factors for heart disease. 1, manage your mental health. You want to make sure you manage your mental health, and so that if you have depression, you want to have that managed. You want to reduce your stress, reduce your anxiety, and this will help to reduce your risk factors for heart disease. When you are someone who has anxiety and stress, that causes your stress hormones to increase, like cortisol and adrenaline. These stress hormones can lead to a constriction or a tightening of heart arteries, which can increase your risk factors for heart disease, as well as for strokes. So make sure that you manage your mental health, you seek professional help, and you do activities that reduce anxiety. There's actually a syndrome that can develop from poorly managed mental health called broken heart syndrome, or Takotsubo cardiomyopathy, also called stress cardiomyopathy. And this results from extreme emotion or stress. And literally, a part of the heart stops pumping properly, and you will have a heart disease directly related to extreme stress and not managing the mental health. 2, incorporate mindfulness practices like yoga and meditation. When you do mindfulness practices like yoga, not only is it helping you with the physical health and improving your cardiovascular health, but also with the yoga and meditation and breathing practices, you are reducing your stress. When you do slow, deep breathing, that actually causes your heart rate to slow down, and it helps to reduce your blood pressure, which of course will reduce your risk for heart disease. Be sure to watch my video on how to reduce your blood pressure naturally after you finish watching this video. 3, avoid prolonged sitting. When you sit for extended periods of time, especially when you have a lot of screen time, like watching TV, being on the phone, playing video games, it has been shown to put you at an increased risk for heart disease. In fact, there was a study published by the Journal of the American College of Cardiology that showed that people who had screen time of 4 hours or more compared to people who had less than 2 hours of screen time per day, the ones with the long screen time had a very distinct, definite increased risk for heart disease. In fact, they studied 4,000 patients, and they went through and they made these comparisons independent of other risk factors like smoking, obesity, high BMI, independent. If you had high screen time, prolonged sitting, you had a greater risk for heart disease. They also studied certain inflammatory markers like CRP, C-reactive protein, and they found that people who had 4 hours or more of screen time each day had twice as much CRP as those who had less than 2 hours. In other words, they had more inflammation in their bodies. And we know that when you have high inflammation in your bodies, this can increase your risk for heart disease, increase the risk for plaques and cholesterol to stick inside of inflamed vessels, and increase your risk for heart attacks. So avoid prolonged sitting in order to reduce your risk factor for heart disease. You want to not only stand up throughout the day, at least every hour, but you want to move your body, move around. 4, build a strong support system. When you have a strong support system of family, friends, loved ones, people who encourage you, that is a way to reduce your risks for heart disease. Of course, being around people who are supportive can decrease your stress. It can also be encouraging for you to do things that are happy activities where you have more endorphins, and you promote yourself by doing healthy activities when you're around a positive support system. So make sure you get in contact with those families and friends and keep those people in your life who are positive and adding to your heart health. 5, prioritize your oral health. Yes, keep your mouth clean. Don't be a yuck mouth because you don't brush. Studies have shown that having poor oral hygiene increases your risk for heart disease. According to the CDC, half of adults over the age of 30 have gum disease, and 70% of adults over the age of 65 have gum disease. So here's what happens. So in your mouth, you have billions of organisms. You just do. You have billions of bacteria. And when you're not brushing regularly and you're not flossing, then these bacteria will really flourish, they'll thrive, and you'll get some anaerobic bacteria, the bacteria that thrive where there's no oxygen in between your teeth when you don't floss properly. And this can lead to gum disease. Now here's what happens. If you get gum disease and you brush, you can get bleeding gums, right? The gingivitis. Well, once you get the bleeding gums, well, now you've opened up your blood vessels to those bacteria that can enter your bloodstream, get all over your body, and now you have increased inflammation in your body, increased inflammation in your heart vessels, and this poor oral health can increase your risk for heart disease. Make sure you're brushing 2 to 3 times per day, and you're flossing at least once a day, and make sure you see your dentist regularly to help you to prevent having heart disease. 6, address your gut microbiome. Yes, studies have linked having a healthy gut microbiome to having good heart health. So make sure you consult with your physician on a healthy anti-inflammatory diet that's filled with fiber, fermented foods, so you can have good gut health, which can lead to good heart health. 7, Eating a healthy diet can reduce your risk factors for heart disease. You want to make sure you have a diet that is low in saturated fats, low in trans fats, low in cholesterol, low in added sugars. I'm telling you, added sugars can be a real trick. It can lead to inflammation and it can promote heart disease. Be sure to watch my video on what does sugar do to your body. 7 dangerous side effects of sugar after you finish watching this video. 8, regular physical activity. You know you need regular cardiovascular activity and exercise in order to reduce your risk factors for heart disease. When you exercise, when you do that good old cardiovascular exercise, that helps you to maintain a normal blood pressure. It helps you to maintain a healthy weight. It also gets endorphins going and helps you to reduce stress. And this can help to reduce your heart disease. According to the American Heart Association, the average adult should have at least 150 minutes of moderate exercise per week. So that's like 30 minutes of exercise 5 days per week, or 75 minutes of vigorous exercise per week. 9, maintain a healthy weight. When you maintain a healthy weight and a healthy BMI or body mass index, then we know that that can help to reduce your risk factors for heart disease. Now, if you have a BMI that is 30 or greater, then you are considered to be a person who's living with obesity. And we know that obesity is a risk factor for heart disease. Obesity can increase a risk factor for coronary artery disease. It can increase your risk for high blood pressure, for abnormal heart rhythms like atrial fibrillation or atrial flutter. Obesity can increase your risk for pulmonary hypertension. In fact, the American Heart Association reclassified living with obesity as being a major risk factor for heart disease. Consult with your physician to find the weight that is healthy for you, the body composition that is healthy for you, and go ahead and strive for maintaining a healthy weight in order to reduce your risk for heart disease. 10, stop smoking. Stop smoking cigarettes and stop using tobacco products, please, because it has been a proven risk factor for heart disease. It can also lead to poor circulation, claudication, like if you get those painful cramps in your legs. You know, it's a risk factor for many cancers, not just lung cancer, but also cervical cancer, skin cancer. There's really no good news with cigarette smoking, so please stop. And that's another way that you can reduce your risk for heart disease. 11, limit your alcohol use. When you drink excessive alcohol, that can lead to high blood pressure, which of course can lead to heart disease. You want to make sure that you drink in moderation or don't drink at all. The other thing is that when you have excessive alcohol use, it can actually lead to a dilated cardiomyopathy. And so limiting your alcohol is another way to reduce your risk for heart disease. So these are some of the lifestyle changes that can reduce your risk factors for heart disease. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about.